Hi, good day everyone. I'm Ninijas Peltra, second year medical student from LPU St. Cabrini College of Medicine, and I am here to have my demonstration about getting the vital signs. What are the things that you need to get the vital signs? Typically, you should have a stethoscope. You may want to invest on a good stethoscope. Okay, so you have a stethoscope, you have the sphygmomanometer with a cuff. Take note that there are different sizes of cuff that can be used depending on the age of the patient that you are getting the vital signs. If you use the wrong size of cuff, it may lead you to have an inaccurate result, and we don't like that to happen. So we want to have an accurate blood pressure. And then we have thermometer. You can use a digital thermometer, or you can use those that are powered with infrared or sensors. And then we have here, if you have, you can use a digital pulse oximeter, and this is to measure the pulse rate of your patient. You can also get the heart rate of your patient using this device. And then you may want to use a pain scale. So these pain scales are used whenever your patient cannot really express how much pain they feel at the moment. So these pain scales, so you can have the numeric pain scale or the Wong-Baker pain rating scale as I have here right now. So this will help us, or it will help you to assess the pain of your patient. And of course, you may want to provide some cotton and disinfectant for your materials before and using them for hygienic purposes. So what are the things that we gather in vital signs? So basically, we get the blood pressure, we get the heart rate or the pulse rate, and then we have the respiratory rate, we have the temperature, and we have the fifth vital sign, as we call it now, as the pain, together with the oxygen saturation in the blood of your patient. Okay, so let's begin. So I am here with a friend, Rex, and he will help me to accomplish this activity. Let's have first the blood pressure. There are a few things that you need to note when taking a blood pressure. So first and foremost, whenever you want to take a blood pressure of a patient or anyone you know, make sure that he or she has rested for at least 3 to 5 minutes or a few minutes before you take his or her blood pressure. And that is important to let the blood pressure to be normalized, especially when you are doing it in a clinical settings. Whenever your patient has arrived on the room or the clinic, it is important to make sure that he or she has rested for at least a few minutes before you take the blood pressure. And make sure that the patient is sitting comfortably on the chair, legs are not crossed, and feet are on the ground. His back is rested on the chair, as you can see here, and the arm that you will be using is slightly bent like this one. And make sure that this part is on the level of his heart. And whenever, just in case if you will take also on those that are lying or in the bed, make sure that this part is also level on the heart. It is done by first palpating for the radial artery, and that is important because we will be using the radial artery to check for his systolic blood pressure and diastolic blood pressure. So it is somewhere here. Let's roll up the sleeve and make sure that this area is free of any clothing material. And then let's put the cuff. Remember that you need to use the right size of cuff to your patient. So after palpating for the brachial artery, take note of these markings. So since we are using his left arm, this marking should be pointed to the position of the brachial artery. So that should be there. And it is about 2.5 inches, 2 to 2.5 inches above the bend of the elbow. So make sure it is not too tight nor too loose. If 2 finger fits there, then that's okay. And then place your stethoscope on the brachial area, brachial artery. There it is. Where your stats. I will now inflate the cuff. So normally, it will take about 180 to 200 millimeters of mercury to occlude the blood flow. And from there, we will release the cuff slowly and take note of the sound. So the first Korotkoff sound, by looking at the gauge, take note of that. And that will be his systolic blood pressure. So about 128 over 80. So the last Korotkoff sound that you would hear will be his diastolic pressure. And then record your findings. So 128 over 80. Deflate the cuff and of course remove it from your patient. Make sure to sanitize your material if it is not disposable. The next vital signs that you would want to get is the heartbeat and the respiratory rate. So we can get the heartbeat on different locations. So we can palpate for the radial artery. We can have it on the brachial. It can be on the carotid. But the most common area that we use for getting the pulse rate is on the radial area. So let's palpate for the radial area. Make sure that the arm is at rest and it is free from any stress. Once you feel the pulse, take note of the time. Count for about 1 minute. So let's wait for 1 minute. Whenever you are counting for the pulse rate, take note of the regularity and the rhythm of the pulse rate. If it's normal, you can count it for 30 seconds and multiply it by 2. But it is more accurate to have a 1 minute count for it. So the normal pulse rate for an adult should be 60 to 100 beats per minute. If that is on that range, then that is normal. Okay, so that's about 72 beats per minute. Now, on this exact position, same exact position, we would like to extend another minute to count for the respiratory rate. Now, it is important that you don't tell your patient that you are counting their respiratory rate, or it will make them conscious and may alter their respiratory rate. We will observe the chest of your patient. So one rise and one down, that is one round of respiration. Or you can also feel it on their back. Take note of the regularity and the rhythm of their breathing. Take note if there are some labored breathing or there are some difficulty in breathing. And again, if that is normal, you can just count up to 30 seconds and multiply it by 2. But to get more accurate result or more accurate respiratory rate, you may want to count that for a whole minute. The normal respiratory rate for a normal adult would be 12 to 20 respiration per minute. The next and the fourth vital sign that we would want to get is the temperature. We can use any type of thermometer. We can have the normal thermometer, but now we don't usually see those that are using mercury. But instead, we are using this kind of thermometer that is digital, and it can be used orally, rectally, but most commonly for hygienic purposes, we are commonly using it for the axillary region. Again, for hygienic purposes, before you insert it on the axillary region of your patient, make sure to disinfect it using a cotton and alcohol. So let's ask our patient to put this thermometer in their axillary region. Sir, can you put this on your axillary region? You can allow the patient to put it on his own, or you can assist them. And let's wait for the beep that will indicate that it is done measuring the temperature. Okay, so I think I heard the sound. Once you heard the sound, you may want to get the thermometer and check for the temperature and then record it. So it is 36.5 degrees Celsius. And that's normal. The normal temperature of an adult or a normal person would be 36.5 to 37.5. After using it, again, disinfect it with disinfectant before you keep it. The fifth vital sign, as we call it now, which is the pain, we would like to assess the pain of our patient. So you can use different scales in assessing the patient's pain, like this one, Wong-Baker Faces Pain Rating Scale. So these ones are used if your patient cannot really express how much pain do they feel. But if they can assess their pain by asking it numerically or rating it with a numerical pain scale, then that would be enough. Now, I would ask my patient if he feels a pain. Now, from 0 to 10, can you tell me, being 0 as no pain and 10 as the worst pain, can you rate your pain right now?
0, sir.
Okay, so he said 0, that means he doesn't feel any pain right now. But if your patient tells you that it's about 8 or 9, you may want to take note of that on your history taking. Ask more about the pain and other attributes of the pain. If you have a digital pulse oximeter, you can use this to assess the oxygenation in the blood of your patient. So ask the patient to have their hand resting on the table. And the most commonly used finger that we use for this one is the index finger, since it is richly supplied by the brachial artery. Okay, so let's wait for a few seconds to get the result. And that's it. So oxygen saturation is 98 and the pulse rate is 76. So you can also use this to check your previous record of the pulse rate, if they tally or not. Make sure to disinfect again your material before you keep them. And that's it. That's how you get the vital signs of your patient. And one thing you should remember is to disclose it to your patient, because that will help them to be aware about their vital signs. So tell them if it's normal, if it's not normal, so they can do something about it. And about your materials, always do not forget to disinfect them before and after you use them on a patient. Of course, you have to sanitize your hand after your vital signs taking. And that wraps up my demonstration for the vital signs. Thank you for helping me, Rex, and God bless everyone.